first question I have is how have the COVID-19, how has COVID-19 and the restrictions around it amplified social determinants of health such that already vulnerable populations have become even worse or even more so, more vulnerable? Let's start with Sharon. Why don't you give us your kind of thoughts upon this?
Sure. It's been a sad and fascinating process to follow as we look at the preponderance of illness and the preponderance of exposure to illness in the lower socioeconomic status groups. Just in New York City, as social distancing is was being implemented, you realize that people who were poorer had to take the bus and the train to get to work, and they still had to go to work. So the rate of exposure was higher based on poverty. And I do think that from a social determinants of health perspective, poverty is going to be one of the leading factors in terms of risk of getting the illness, risk of exposure to the illness. There was an interesting article in the New York Times today that talked about the life expectancy based on poverty. And in the city where there were the biggest differentiator was Washington, D.C., with 26 years between the richest and the poorest of that city. And in New York, it was 92 years old for the people who lived in the richer parts of the city and 71 years old for the people who live in the poorer parts of the city. I think that dichotomy is true everywhere. What I don't know, and I'm not sure we know a lot about yet, is the poverty that exists in very rural environments where people are socially isolated, but also have no access to healthcare because the rural communities are really experiencing a lack of access. The other piece is for people with pre-existing chronic conditions, especially those which are related to things like obesity and smoking, which have a higher rate in the poorer communities also, people are not getting access to their usual preventative medicine. And so the overall disease state picture is rising. Again, I believe based on poverty, which correlates to lack of access to good food and lack of access to easy travel and lack of access to healthcare and all those other kinds of things.
Great, thank you, Sharon. Steve, your thoughts?
Yeah, I thought that one of the areas that's really being amplified at this point, particularly in poverty, is what we've seen with this crisis is an incredible ramp up in telehealth, which has also pointed out the fact that we have a true digital divide occurring in our country, and that has been brought to the forefront as a result of this crisis. So we see people that just simply can't have access to care at this point in time. They don't have the means for it. And it impacts other areas as well. Families that might have one computer and 5 people trying to deal with the educational portion of this process. There is going to be a huge segment of population that is going to lag educationally as well. So yeah, the medical, the behavioral health issues, but also the other social determinants of health around education and even work and trying to be engaged in those other areas as well.
Good, thanks. George, your thoughts?
Well, both Sharon and Steve pointed out some of the major points. I'd just like to add that in my experience in healthcare in both urban and rural settings, is that you're more likely initially to see a higher proportion of people with any pandemic or epidemic, including drug abuse and some of the more serious issues that have come up with that recently. You're going to see more of it, and you're going to see a higher profile of it in urban settings initially, but eventually in rural settings, it will have just as big of an impact. And I think we just don't know yet in the rural settings, but you know that with the poverty, and then once people become more mobile, they will start, when the shutdowns start when they stop some of the shutdowns and people become mobile, especially in these warmer months, you'll see more spread of it in the rural areas, and you'll see all the discrepancies in their healthcare services come to play, and how quickly it'll spread amongst those people living in those areas as well. I think one of the things that we have to pay attention to in any setting is the high density of living. The more people are living in highly dense environments, we've seen it spread so quickly and so effectively, and so we have to be aware of that as part of the issue that poverty plays a role in, but also any population, that will be a determinant of people being able to protect themselves if they're in a very high dense living situation.
Great, thanks, George. So the second question I have is, what is the impact on those that are homeless, and what are some initiatives launched to support this population? Sharon, I know this is a special interest in, you have special knowledge of this particular population.
Yeah, so it's interesting when you look at, kind of the public health epidemiology view of it. At the beginning, homeless people were out on the streets and therefore actually were somewhat protected because they were social distancing. And then as cities tried to get people to get into shelters, it backfired in terms of the rate of infection in congregate care. Nursing homes and shelters both have really high rates of infection. When you add on the potential for substance use in addition to that, you get an incredibly vulnerable population. So one of the cities that I do work with through Open Minds is Philadelphia, and they've actually created a living situation for people who are homeless by using a hotel. And they're then providing, through their Department of Behavioral Health, providing peer coordination. They can check whether someone has Medicaid eligibility and is therefore, has access to certain kinds of services. And if they don't, they can draw down their state and local money in terms of their government-funded services for the uninsured. So they're able to get more services to more people, or able to give people a place to go when they know they need services. Again, the difficulty is that the homeless population is a difficult population to communicate with, as Steve made, I think, really the most salient point on this, which is that we have a digital divide. And while there are people, there's been data that shows that almost everybody in the world now has a cell phone. Access to those cell phone numbers, and whether they're, burner phones without a direct number that you're going to keep with you, and getting people access to those numbers, there still is a huge discrepancy around how you get folks into care. And I think this next phase is really that there's a lot of fear around the population that's been living in the streets and is uninfected into going into congregate care because they're worried that it's going to put them at higher risk for infection.
Yeah, good point.
It's one of those spiraling problems. And there's been some dreadful national stories. Two men found dead sleeping in a subway car overnight in New York City. So New York is now, in an unprecedented way, and I say unprecedented because I grew up there and I remember taking the train at 5 o'clock in the morning. New York is now actually shutting down subways and cleaning subway cars at night, which is, really unheard of. So yeah. It's definitely an escalating problem, not a decreasing problem.
Steve, anything you want to add?
Yeah, I had an interesting conversation with a housing authority leader. One of the interesting technologies that is coming out of this, we kind of renamed it telehousing, in that they are able to now, use iPads and other devices to do virtual tours of housing situations, and they're actually finding that it's more efficient and with less barriers, because trying to get people to places in the past for transportation, particularly with a poverty population, is very challenging at times. And now they're able to do these very quick check-ins. They're able to take a look at living spaces, decide whether it's appropriate for that person or that family, and do it more efficiently. Actually, his feeling was they are actually busier now. Of course, there's a larger need right now, so I should say they're more efficient now in filling some of the spaces that they do have than they were before this. So there's been some other the innovation in this overall picture has been absolutely fascinating.